Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for a patient with heart failure. In this module, you'll learn what's involved in caring for a patient with heart failure and how to deal with common patient questions and concerns. We'll begin with the report you received from the nurse who was last on duty. The summary report you'll hear today is in the SBAR method: situation, background, assessment, and recommendations.
Angela, hi. You're the next nurse for Mr. O'Reilly, right?
I am, Cynthia. How are you?
Good. How have you been?
Great.
Excellent. All right, here's the situation. Our patient's name is John O'Reilly. His doctor is Dr. Amit Rangarajan. John is a 52-year-old male with no known drug allergies. He was admitted last night with heart failure. He's here because over the past few weeks, he's been experiencing worsening shortness of breath and has gained 10 pounds in the last week alone.
So what did they find out in the ER?
Well, in the ER, Mr. O'Reilly's vital signs were temp 99.1, blood pressure 160/90, heart rate 88, respirations 26, oxygen saturation 90% on room air. A chest x-ray revealed pulmonary congestion with bilateral pleural effusions. His potassium level was 5.0. They administered 40 milligrams of IV furosemide and sent him up to us. They started him on 2 liters of oxygen by nasal cannula. Now, for his past medical history, he has mild hypertension and elevated triglycerides, and he had arthroscopic surgery on his left knee 10 years ago from a football injury. In terms of medications, before arriving at the hospital, John was prescribed metoprolol, 25 milligrams daily, and naproxen as needed for pain. He was admitted to the telemetry floor and started on the following medications: IV furosemide 40 milligrams twice daily, which was given in the ER last night, lisinopril 5 milligrams daily, and the metoprolol at 25 milligrams daily. The patient took both of these yesterday at home, so they'll start today. Neurologically, the client is awake, alert, oriented ×3. Cardiovascular, the heart rate is regular, no adventitious sounds noted. +2 edema in bilateral lower extremities and has an IV site in the lower left forearm. Respiratory, rales are noted in bilateral basis, and he's still on 2 liters nasal cannula. Gastrointestinal, his abdomen is soft with positive bowel sounds, had a bowel movement yesterday prior to coming up to the ER. Genitourinary, he is voiding clear yellow urine without difficulty. And integument, his skin is clean, dry, and intact. Do you have any questions?
Where did you say the IV is?
The left forearm. For recommendations, I'd make sure you follow up on the lab work that was ordered for this morning. You'll want to check his potassium level before you give him his morning furosemide. I'd continue to monitor his respiratory status. We want to make sure his rales and the shortness of breath continue to decrease. Try to keep his lower extremities elevated to help reduce the edema in his legs.
Great. Is that everything?
Yeah, that's it.
All right. Have a great day, Cynthia.
Thanks. Have a great shift.
Thank you.
You're about to watch a registered nurse conduct a focused assessment of a patient with heart failure. Note how she performs each step and, just as important, how she explains what she's doing to help the patient understand what's being done and why.
Hi, Mr. O'Reilly. I'm Angela. I'm going to be your nurse this morning. How are you feeling?
Well, I'm in a hospital room, but other than that, I guess I'm okay.
I understand. I'm going to go ahead and wash my hands right now, and then we'll get started with my assessment, all right? Okay, the first thing I'm going to do is check your ID band. So why don't you just tell me your full name and date of birth?
John O'Reilly, November the 3rd, 1957.
All right, that checks out. So we're going to get started with your vital signs. The first thing I'm going to do is check your temperature. Place that under your tongue. Great. 98.5, that's normal. All right, I'm gonna take your blood pressure, but since your IV's on this side, I'm gonna go around. Okay, I'm just gonna put this cuff on. 148 over 86. (148 over 86). That's a little high. Do you know what your blood pressure normally is, Mr. O'Reilly?
No, I only get it taken when I go to the doctor's office. I really don't remember what it was last time I was there.
Well, because you have a history of hypertension, that's why you're taking the metoprolol, it's important for you to measure your blood pressure at least once a week. You know, most drugstores have blood pressure devices that are really easy to use, and that can help you monitor your blood pressure at home. It's important to check your blood pressure regularly, otherwise you don't know if your hypertension's under control. And keeping your hypertension under control may help prevent the shortness of breath and weight gain you've experienced from recurring.
Yeah, my doctor suggested that I get one of those things, and I guess I should have taken his suggestion a little more seriously. While we're on the subject, that metoprolol? Metoprolol? Yeah, I don't like the way it makes me feel, and neither does my wife. You know, so I haven't been exactly taking it like the doc said to, just a couple times a week instead of every day.
It's really common for beta blockers to cause those kind of problems, but there are alternatives. So if you'd like, I can express your concerns to your doctor. Maybe he can adjust your medication and prevent those symptoms from recurring.
Well, I'm glad to hear that I'm not the only one that had that happen to him. And yeah, if you'd mention it to my doctor, I'd really appreciate it. I've been meaning to talk to him about it, but I just didn't know how to bring it up in conversation.
You know what? It's really important right now for us to find an antihypertensive that's good for you, one that you feel comfortable taking every day. So I'm happy to talk to your doctor about it right away.
Okay, thank you. And thanks for listening.
You're welcome.
Problems such as erectile dysfunction are a common side effect of the antihypertensives classified as beta blockers. Patients are often hesitant to talk about this subject.
Okay, I'm just gonna go check your oxygen, make sure that it's set properly. Well, that's set properly, so now I'm just gonna check your heart rate. All right, your heart rate is 70 and your respiratory rate is 20. Now I'm just gonna check your oxygen saturation. I'm gonna place this monitor on your finger. All right. (98%). That's a great improvement over last night. Do you feel like your breathing is better today?
Yeah, it does seem better than when they brought me into the emergency room last night. I was so short of breath last night, I could hardly talk. I didn't know what was going on, and it really frightened me. I mean, all I could think of was my family, and what if something happened to me? Who's going to take care of them? And what about my wife and the kids? Who's going to pay for their college? I mean, I've got one in college now, and the other one starting next year. So I was really worried. I felt really helpless.
It sounds like last night was really scary for you.
It was. I've never been so scared ever before. I know my body's not back to normal, but I'm relieved that I am feeling a little better.
I'm so glad you're feeling better, Mr. O'Reilly.
Thanks.
The next part of my assessment is listening to your heart. So if it's okay, I'm gonna need to place my stethoscope under your gown.
Sure.
I'm just gonna shut the door first, okay?
When performing a cardiac assessment, listen to the 5 areas of the heart, assessing for a possible S3. An S3 heart sound is a sign that the heart is beginning to fail and that increased blood volume is filling the ventricle with each beat. If the heart rate is rapid, the ventricles will have less time to fill, leading to a decreased stroke volume and increased pressure in the atria. Be sure to document the heart rate and rhythm after your assessment and notify the doctor about any abnormal sounds. Asking the patient to turn to his left side, if possible, makes it easier for you to hear any abnormal sounds.
Now I'm just going to ask you to lean over a little bit to your left-hand side so I can hear the sounds from another position.
Okay.
That's great. Your heart rate is regular and there's no unusual sounds. I'm going to listen to your lungs now. I'm going to listen first from the front and then from the back. So let's use the bed to help you sit up a little bit.
Okay.
When performing a respiratory assessment on a patient with heart failure, listen for any abnormal lung sounds.
I just want you to take some deep breaths in and out of your mouth.
Pay particular attention for rales or crackles. These are a sign of fluid overload and a common finding in a patient with heart failure.
Let's have you sit up a little bit so I can listen to your back.
Okay.
Again, some deep breaths in and out of your mouth. You can sit back now. So, you have some mild rales or crackles in your lungs?
What's that mean?
Well, that's from the fluid in your lung tissue. You see, your heart is having trouble pumping the blood it receives from your lungs. As a result, the blood backs up into the vessels of the lungs, causing fluid to leak out into the tissue. That fluid is what's causing your shortness of breath.
Oh, okay.
So the furosemide that your doctor gave you last night, that's going to help move that fluid out of your body. It's going to make your heart's job easier, and it's going to make it easier for you to breathe.
Good.
I'm just going to take a look at your IV site. Has it been bothering you?
No, it hurt a little bit when they first put it in, but it's been fine since.
When assessing the IV site, check for redness, edema, or drainage. Any of these findings is an indication that the IV site should be changed.
It looks good. Another place fluid can build up in your body is in your legs and your feet. And that's because the blood backs up into the veins, forcing fluid into your tissues, and that's what we call edema. So let's take a look at your feet and your ankles and see how they're doing.
Okay.
There's a little swelling here. When I release my fingers from the skin, an indentation remains. That's called +1 edema. So tell me, when you get home from work, do you notice that your shoes feel tight or that your ankles are swollen?
I don't think so, but I don't pay any attention to it. Guess I could make note of it a little more, huh?
That would be a good idea. If you notice that your feet or ankles are swollen when you get home from work, I'd recommend that you just elevate your feet whenever you get a chance, and that will help reduce some of the swelling.
Okay.
Great. Now, Mr. O'Reilly, I'm going to need to get your weight before breakfast.
Oh.
I have a gown that we can use as a robe to keep you covered up.
Okay, that sounds like a good idea. Oh.
Weighing the patient should take place at the same time every day, on the same scale, and with the patient wearing the same amount of clothing.
Okay.
You know, I gained 10 pounds since last week.
I know. Well, that's what your previous nurse told me. Do you weigh yourself at home?
No, I figure when I go to the doctor's office, his scale's more accurate than mine, so I do it there. But I was there last week, and that's how I knew I gained 10 pounds.
Yes, and that 10 pounds is a sign that your body is retaining water because your heart is not pumping as efficiently as it should be.
Oh.
So just like your blood pressure, it's going to be important for you to monitor your weight on a regular basis.
What do you mean by regular basis?
Every day.
Oh, really?
If you monitor your weight every day, you'll be able to detect changes in your condition, and that will allow you to get help sooner.
Okay.
If you gain more than 2 pounds in one day or more than 5 pounds in 1 week, you'll want to let your doctor know.
Okay.
It's really actually pretty easy. There's just a couple of things you want to remember when you're weighing yourself at home. One, you want to make sure that your scale is on a hard surface like the bathroom floor. And two, you want to make sure that you're weighing yourself at the same time every day with the same amount of clothes on.
Okay, I can get into a habit like that.
It's really just as easy as walking into the bathroom, and you do that every day, right?
Yeah, I do.
All right, Mr. O'Reilly, do you want to lay down and rest a while?
Yeah, I am kind of tired.
Let me get this. Are you more comfortable now?
Yeah, thanks.
Would you like me to elevate your legs a little bit to help with the swelling?
Oh, if you think it would help, okay.
I do. Let me just get a pillow.
Okay.
Okay, just lift up your left leg. And now your right. All right, Mr. O'Reilly, we're done now. Do you still have your call button?
Yeah, it's right here someplace.
Let me get it for you.
Thanks.
If you need anything, just let me know, but I'm gonna let you rest for a while, okay?
Okay.
You will return all of the equipment and promote good infection control practice by washing your hands. When compiling your report, keep in mind that by noting trends from one assessment to the next, you can provide helpful insights for the patient's care. Based on your assessment, your nursing diagnoses for Mr. O'Reilly may include deficient knowledge of the disease process for hypertension and heart failure, deficient knowledge of the prescribed medications and their potential side effects, excessive fluid volume and retention of fluid related to heart failure syndrome, and powerlessness related to the inability to perform role responsibilities due to chronic illness and related medications. Helping patients learn about their medications is an important part of nursing care. In the case of the patient we've been watching, this teaching would take place after breakfast, around 9 a.m.
Hi, Mr. O'Reilly. It's Angela again. I'm here with your morning medications. I'm just gonna wash my hands and then we'll get started, okay?
Okay.
The nurse has prepared all of the medications in the medication room and is ready to teach the patient about the medications and then administer them.
All right, I just need to check that ID bracelet again. Go ahead and give me your full name and date of birth.
John O'Reilly, November the 3rd, 1957.
Okay, let me just check that. John O'Reilly, November the 3rd, 1957.
You got it.
All right, well, let's get started. The first medication is metoprolol. As we talked about that earlier, it's a beta blocker that's used to treat hypertension and heart failure. Because beta blockers work to slow the heart, I'm just going to want to make sure that your heart rate is above 50 beats per minute before I give it to you. Even though I already checked your heart rate at the telemetry station, I'm going to go ahead and check it manually just to make sure it hasn't changed, okay?
Okay.
Great, 74 beats a minute, so we're good to go here. Metoprolol, 25 milligrams PO daily. Metoprolol, 25 milligrams PO. Here you go.
Okay.
Your next medication is lisinopril. Lisinopril is an ACE inhibitor, another class of drugs that's used to treat hypertension and heart failure. One of the most common side effects with lisinopril is a frequent dry cough. So if you develop a cough that is a problem or that becomes annoying, just let me or your doctor know, okay?
Okay.
Lisinopril can cause an increase in serum creatinine levels. Before administering this medication, it's important to check that the patient's creatinine levels are in the normal range. Review the trends, and if there is an increase, notify the physician before administering the medication.
It's fine. Your creatinine's normal and it hasn't changed a bit. All right, lisinopril 5 milligrams PO BID. Lisinopril 5 milligrams PO. There you go. All right, the last medication I have for you is furosemide. This is an intravenous medication. As we were talking about earlier, it's a diuretic, and diuretics help to remove some of that fluid from your body.
Okay.
You'll find that you'll need to urinate a little more frequently with this medication. So when you need to go to the bathroom, go ahead and use the urinal because we want to record your urine output today. When you're done, just let me know so that I can empty it. Although you're getting the furosemide through your IV here, it's possible that your doctor may or may not prescribe it for you at home, and if he does, it will probably be in the pill form.
That's a relief.
Now, before I give you your furosemide, I want to just go ahead and make sure that your potassium levels are okay, and I need to recheck your blood pressure.
Okay.
A low potassium level can actually make you have an irregular heartbeat, and we really want to avoid that right now. If you're actually prescribed the furosemide at home, we're going to send a dietitian by so she can go over some good diet choices for you. We want to make very sure that you get enough potassium daily in your diet.
Oh, okay.
Prior to administering furosemide, assess the latest potassium level and blood pressure. If either the potassium level or the blood pressure is decreased, talk to the doctor prior to administering the medication.
It's just going to get a little tight as I squeeze it up. All right, your blood pressure is 148/76, and your potassium 4.0. So we're good to go. Let me just check the medication first. Furosemide 40 milligrams IV BID. Furosemide 40 milligrams IV. I'm just going to look at your IV site.
Inspect the IV site for redness, edema, or drainage.
Good, it doesn't look red. So the first thing I'm going to do is just to flush your IV with some normal saline, okay?
Oh, okay.
Gently flush the IV with 0.9 normal saline. After flushing the IV site, administer the furosemide and then flush the IV site again.
This is going to feel a little bit cool. Good. It doesn't look like the IV is leaking. Did that feel okay?
Okay, a little strange. Doesn't hurt though.
Okay, now for the medication.
When administering furosemide by IV push, It's important to infuse the medication no faster than 20 milligrams per minute.
Okay. And now I'm just going to flush your IV again. Once again, this is going to feel a little bit cool.
Okay.
Did that feel okay?
Yeah, I can feel it.
I'm just going to write this down. All right, that's it for now. If you need anything else, just let me know. Do you still have your call button?
Yeah, it's right here.
All right.
Fine.
I'll see you in a little bit.
Thanks. I'll buzz you if I need you, huh?
Great. Toodaloo.
Okay, see you around.
Thanks for watching this video on caring for a patient with heart failure. Be sure to also study the instructions in your textbook, and please review this presentation at any time to support your learning and patient care.